medicines, but you'd better go fix the roots so that you can just look at them as a support. All right? And then it works an awful lot better. And man, with somebody with better than 43 years of experience in medicine, coming from a medical faculty and board certified in a couple of areas and all orthodox as can be, over into learning about the fact that you must get the nutrients right, you must remove the toxins, and you must provide for the body to heal itself, has been a huge awakening, and one that has rarely failed me. My patients will fail me more in not following their recipes and my acts, what I ask them to do, then I rarely find them not getting well. Here's something. I used to be really, really turned off by a patient who had 16 or 17 different symptoms. It was a nightmare. Oh, I'm not a neurologist, I'm not a urologist, I'm not an internist, I'm not any of these things, and I used to try and refer these patients all around. Okay, I'm just a distributor of patients, you know? And then I began to see some of these people get well by nutritional techniques, and then I kind of calmed down and said, wait a minute, let's add some nutrients to these programs, see what drugs we can pull off, and see what happens to them. And I mean, what a difference. So now, one of my basic models is to understand, I want my patients to be so well that they can't be sick, you know?
Good plan.
And that's why wouldn't you think of that?
Right, I know, it is amazing.
Or if there's fault in what I'm saying, why wouldn't you think of that first?
Right.
Okay?
Exactly. Yeah.
And I think the people watching this are gonna see the same sense in that. And yet, if people want instant relief, they don't want to wait more than 6 or 7 minutes at a hamburger place. They want this and that. And they are entitled to relief of their symptoms. Sometimes I do that. But at the same time, I have to advise them in the same setting that this is unwise and this is something we'll be undoing, because another thing that I've rarely ever seen, and I've talked to pharmacists and I've talked to doctors and I've talked to large groups of people, I've never found a doctor or a pharmacist that has ever been able to answer this question. And this question is, except for penicillin or antibiotics and an aspirin, can you name a drug that cures anything?
Yes, I've
never gotten an answer.
Yeah, I'm with you. I totally agree.
Now, people should understand those principles.
Right.
I don't know that I condemn that, but if you make that that's the whole reason you go see the doctor, is to get the proper pills to match whatever, you know, recipe that you have that fits into this is your disease, and that's rarely not right. I mean, that's rarely right. Then you get your pills and you talk about it on the golf course,
right,
or at bridge.
Right.
Well, I take this and I've been that, and as long as I that, and as long as I get this. Look at what's happening. While these people have no symptoms, where they have a normal blood sugar, where they have a nice normal blood pressure, they're falling apart.
Right.
What an injustice.
Yeah. I have a daughter that's has had chronic migraine headaches for years.
Yes.
And I've tried to get her to get serious about addressing the issue that causes it.
Right.
And I can't make her understand that by not addressing the cause of the headaches, it's like driving your car down the road and have the red light comes on indicating you're low on oil, and you just take a piece of tape and cover that up so you can't see it, so you think, oh, everything's all right. Well, you know that it's not all right, and soon there's going to be a serious problem. And so this has been going on for 20 years, and I can't make her get serious about doing a liver cleanse and doing some of the other things that address the root cause that would cause migraines on a chronic basis.
I'll tell you what, here's a gift for her if she'll follow this. Tell her to absolutely, totally, not even, this is for emphasis, don't even say dairy. Do not touch anything that is dairy in any way, shape, or form, anything that comes from corn or anything that comes from wheat for 30 days. You'll see those headaches diminish or go out of existence.
Okay, that's great. Appreciate that.
That will do it. That will do it. Next. It's almost too simple to believe, but listen. you and I have been around. We've done an awful lot of things, okay? We know what works, but we know what's just half workable.
Right.
And I'm telling you, from the tone of my voice and also from my rich experience, that this works oftentimes, many more times than it fails me. And our commitment to see people well, here you've got your daughter, and here I know of a person suffering from migraine headaches, to get that fixed and have that go away would be a gift for both of us,
Right.
let alone her.
Exactly.
And that's where that advice comes from, period. It's not the shortage of beta blockers. It's not the stressful life that she lived. It's not the da-da-da-da, the yada-da-da. Some women do have some migraines associated to their hormone flows, but I'm telling you they wouldn't if they had these other basic ingredients out of their life and they had some just foundational nutrition. You know, it starts with A, B, C, D, and E.
Right.
Isn't that neat? It's easy to remember.
I know she's a vegetarian,
Yeah,
and probably 50% of her diet is pasta.
yeah,
And I can't make her understand that there's no nutritional value there.
yeah.
And it's just starches that cause more of a problem than help.
Roger that.
And so anyway, I appreciate you pointing this out. Hopefully she'll pay more attention to what you have to say than what I say.
It's always the case.
Right.
You're never, ever
Right.
a prophet in your own family,
Yeah, for sure.
you know?
But the nutritional supplements, now, I know that we talked before about some nutritional supplements, and with this at appropriate time, would you like to talk about some of the supplements that you believe in?
Yes. Yeah, kind of starting in the basics again.
Okay.
The A, B, C, D, and E's. I'll skim over those because you can Google this and just be shocked at the amount of information that's there that is backed up by research. Let me take a side road and put it in park for a minute.
Okay.
You'll have doctors and other so-called authorities that say that this isn't proven, what we're talking about. You'll even hear patients tell you, well, that isn't proven. And I'm going to tell you that if you set an MD down to read 8 hours a day, 5 days a week, all of the refereed and proven literature about these alternative therapies, they would never see another patient as long as they lived. There's that much information about this. Very well proven stuff. Okay, second, you start out with getting enough vitamin A. Okay, these are things that help respiratory passages, these help the skin, they help you with your nervous system and everything. These are just general remarks, so we don't have to get in too deep. You can't take too much vitamin A. Second, if you have reports of it in the literature, it's because somebody took only vitamin A and they didn't have any D and they didn't have any C and they didn't have any B complexes. And it's usually reported by people who just don't understand nutritional therapies. And that's always been sort of one of the, arrows in the side of doing medicine this way. You take your B vitamins. I help people remember this, that B stands for brain. So memory is in there, but backache, confusion, brain fog. You see people do very well in lowering their cholesterol by using niacin. You see people doing very well by using all the B vitamins in the mix of the A and B. Now C, you can't say enough about this. This Linus Pauling won the Nobel Prize in chemistry, not in medicine.
Yeah.
But he won the Nobel Prize in chemistry, and I mean, like he said, for 10 cents a day we could cure most all the health problems of the people in the world. Well, it's probably gone up in today's markets, but at the same time it's profound what it can do, even to this extent. University of Kansas, at this time that we're speaking here in 2008, have an investigative number so that they're treating cancer patients with intravenous vitamin C and a few moderate dietary changes and getting excellent results. It's that important. But yes, it handles your mood, it handles all the connective tissue in your body, it handles all the bleeding and all the repair that goes on in your body. It's a very necessary part of it. So there's your C. Look on the label if you want to know how much to take. It varies from people to people.